The digitalization of healthcare has reached mass adoption, undoubtedly simplifying things like patient intake, record exchange, patient tracking, and treatment. It's indisputable that technological improvements and revolutions in healthcare have occurred, and these are being quickly welcomed by the health industry. In this episode of Future Tech Eden, we'll look at the newest and most advanced forms of tech used for health management. Before we start though, make sure to give this video a big thumbs up, subscribe to our channel, and hit the bell icon for notifications. Now, without further ado, let's begin. The Internet of Things, IoT. Medical facilities are packed with gadgets that contain heaps of data, and it can be hard to keep everything organized. Thankfully, though, the Internet of Things, IoT, allows all of these otherwise separated pieces to communicate with one another, and the benefits have been instant. Mount Sinai Medical Center in New York City reduced emergency room wait time by half thanks to GE Healthcare and their IoT software called Autobed. Autobed monitors the occupancy of 1,200 beds and handles up to 80 bed requests at once, resolving the jigsaw puzzle of who goes where and when more efficiently by considering nurse proximity, detailed demographics, and over a dozen other criteria to better analyze and aid patients' particular requirements. IoT can also be used to monitor a facility's medical technology and send out warnings when they fail or are about to fail. An example of this is the Philips eAlert that monitors MRI machines and sends smartphone updates and performance reports to employees, saving both money and time. Additionally, IoT may be used to track personnel, patients, equipment, and other assets in a critical context. And with leading companies like Microsoft offering enterprise-level healthcare to IoT solutions, this feature is set to become an essential component of a medical facility's infrastructure in the near future. Artificial intelligence, AI. Artificial intelligence has been making significant waves across numerous industries, including healthcare, as a valuable technology in this day and age. As health frontliners scramble to handle waves of COVID-19 patients, they'll increasingly turn to solutions that can do part of the job or foresee a need before it arises. The demand for efficient and touch-free interactions has the potential to increase clinical usage of natural language processing by smoothly sending data into a patient's electronic health record. On the other hand, automated services such as symptom checking chatbots could continue to alleviate administrative bottlenecks. In the near future, high-level AI applications could evolve to provide individualized treatment. Algorithms and machine learning could be used to diagnose cancer and heart disease, and virtual assistants could offer prescription reminders and robot-assisted rehabilitation for patients. Remote care and telehealth. Telehealth has come a long way since the beginning of the pandemic in 2020. Nowadays, care practitioners can video call patients over the internet on a regular basis to address concerns and offer suggestions, and the infrastructure this requires has greatly improved. By 2026, telehealth is predicted to be worth $185.6 billion. Telehealth has emerged as one of the most important developments in medical technology, thanks to advancements in video conferencing, mobile internet, and smart wearables. It's now so easy for practitioners to have one-on-one consultation with patients who are from remote locations or are unable to get transportation to a physical institution. Also, regular checks can assist elderly persons living alone to prevent strokes, heart attacks, and other unpleasant incidents. And there's the added benefit of a reduced chance of exposure to other illnesses. Additionally, today's advanced wearable health monitors can measure heart rate, blood pressure, and blood oxygenation. Web or app-enabled supplements can filter patients' requests accordingly, saving both doctors and patients valuable time and energy. Really, even the most basic telehealth sessions have the potential to save lives, as they lower transportational, linguistic, and geographic obstacles to care. Augmented and virtual reality. Imagine telling someone a decade ago that you could heal their chronic pain with something as simple as a video game. Such technology would have been inconceivable 10 years ago, but not now. When it comes to the role of technology in healthcare, virtual reality, VR, takes center stage, and its numerous uses are changing the way doctors treat patients. Immersion in a virtual world or observing real environments with digital decorations no longer exists just in games. Medical practitioners are discovering new applications for augmented and virtual reality with the use of headgear and carefully built software, and our current use of online learning and consultation adds more possibilities. Lifelike surgical training programs, immersive clinical experiences for nursing students, diversion for pain management, management, and even more detailed photograph examination are all options in this new VR world. Clinicians at the George Washington University Hospital, for instance, recently used VR to analyze the lung scans of a COVID-19 patient. VR is also expected to gain popularity in senior living complexes. Although virtual travel and avatar-led chat rooms to some may be nothing more than an amusing game, the engaging and memory-triggering meetings they bring can also be profoundly therapeutic. During quarantine, this technology, which can be utilized alone or with others, opens up a new world for older people. And as technology advances and integrates augmented and virtual reality, this might progress from basic virtual checkups to a whole range of medical treatments conducted remotely, including full-fledged surgical operations with the help of robotics. 3D printing. The first 3D printed object was just a small cup, but the technology's come a long way since then. Medical equipment can now be completely tailored to a patient's exact needs, compatible with their natural anatomy. When implants, prosthetics, and gadgets are properly aligned and personalized, the patient's body is more likely to accept them, resulting in higher comfort and improved performance. External prosthesis, airway stents, and cranial and orthopedic implants have seen the most significant advances in 3D printing, but it's also proved to be useful in surgical planning and has been utilized in difficult open heart procedures. Organ transplants may become obsolete one day with the printing of human tissue. Big data. Big data refers to complicated and enormous data sets that need to be meticulously handled and analyzed to uncover important information that may assist in simplifying routine operations and many other aspects. However, this requires a large investment in professionals who can crunch numbers, detect trends, and assist hospitals in better understanding their market. Big data may be used to investigate the current hospital admission rate and predict future ones. Depending on the data, it can also indicate which hospital is likely to see the most admissions, allowing that hospital to better prepare and allocate personnel and resources to manage every patient. This decreases wait times, saves money, and improves overall quality. Big data can also detect discrepancies in healthcare records and indicate any inaccuracies or gaps that exist between medicine prescriptions and patient health, and it can warn physicians ahead of time if there's a possible mistake. For example, if a specific type of drug is generating ill effects in diabetic patients, big data analysis can reveal this so the drug can be avoided. Lastly, recurring patients, sometimes known as frequent flyers, make up a considerable portion of those who visit the emergency room. Big data can detect this group of patients and assist staff in developing preventive programs to keep them from coming back. Quantum computing. Although quantum computing is still in its early stages, it's already being utilized in conjunction with machine learning to instantly detect medical equipment and annotations during cataract surgery, the most commonly done procedure in the world. While most of its potential remains unrealized, it's already generated considerable optimism for medical imaging, genetics, and drug development applications. A breakthrough amount of processing power may soon be able to analyze all possible outcomes of extremely complicated scenarios, or sequence human genomes more quickly and inexpensively. The flood of data that results from such discoveries may be quantum computed to advance further discoveries. Some tech heavyweights, like IBM, already provide quantum cloud computing as a way for customers to become acquainted with the technology's capabilities. However, real-world applications will require significant effort and expenditure. Although there will be little to no substantial advancements in quantum computing in the near future, there will surely be a lot of discussion and debate about it. What are your thoughts on tech in our current healthcare system? Let us know in the comments below. If you enjoyed the video, hit the like button. Also, subscribe to Future Tech Eden and hit the notification bell to be notified whenever we upload more content. Well, that's about it from us, so thanks for watching and we'll see you in the next video.